Hi guys, my name is Sanjay Gupta and I'm a consultant cardiologist, and today I thought I'd do a quick video on the subject of fainting. The talk is entitled Why We Faint. The first thing to say is that I'll give you an example of the kind of patient I'm talking about. So a few days ago I met a young man in my clinic who came to me and said, look, he's normally fit and well, generally fine. And then approximately a few months ago, he was at work and then suddenly came over all hot and sweaty, became clammy, found that his heart started racing fast. Someone who was watching him said that the color drained out of him. He managed to get up, and then he eventually couldn't get up, so he staggered and fell on the floor. All right, and he laid on the floor for about 20 minutes, and then was conscious during that time, and then came back up, and then went away and did his own thing, and he remained reasonably well. But then after a few more days, the same thing happened, and he has over the past few months had about 5 or 6 of these episodes, and he's very concerned. He was very concerned as to why they were happening. So I thought I'd use him as an example to talk about why we faint. The first thing to say is that it is always very important to draw a distinction between fainting and blackouts. Okay, they're different. Blackouts is a sudden cutout. So the person would be standing, and suddenly, without warning, they fall on the floor. They just black out. Something goes, a light switches off, the person falls. And usually, one of the good signs that tells you that it's been a blackout is that the patient often sustains some injury, because they've had no warning whatsoever. They can't do anything about it, and they fall on the floor and they injure themselves. And often after they fall on the floor, they're able to rise straight away and carry on. Okay. Of course, the injury might keep them down there, but otherwise it's just a sudden light off, light on kind of moment. A faint is different. In a faint, you don't actually black out like this. What tends to happen is people feel unwell, they get a warning, and if they don't do anything about that warning, they eventually end up on the floor. All right. So this talk is very much about those people who are fainting. How would you know? People will tell you. You will know that you are fainting because people who are observing you will tell you that you've started looking unwell for a few minutes before you fainted. You will know that you get an aura, and a lot of people describe either the vision changing, or vision blurring, or bright lights in the vision. A lot of people will complain of buzzing in the ears. Then they'll feel like the blood is draining out of their face. They'll become very clammy. Their heart will start beating fast. So those are generally faints, whereas having none of that is a blackout. So it's very important to draw the distinction between the two, okay? Because they're caused by different things, all right? Blackouts are often caused by heart rhythm disturbances, particularly if the heart is going very slow or very fast. That's what causes a blackout. Similarly, if you have a problem with a heart valve, so something like aortic stenosis, where the aortic valve is so tight that it doesn't allow blood to come out of the heart, then that can cause blackouts. Faints are different, okay? Faints are caused by something else. And I thought I'd quickly talk to you about faints, because once you understand it, it'll be easier to manage it. So to this man, I explained that in essence, faints are things which tend to occur more so in younger people. Okay, and they're often attributed to something called reflex vasovagal syncope. Now, the way to try and explain this is this. Okay, imagine you are standing out in your garden with a hose pipe. All right, and you're watering your plants. So you're pointing your hose pipe downwards. Okay, and you've got the tap set at number 7, for example. You've got your pipe, and you're pointing your hose downwards, and you're watering your plant. Now, this is what we do. Okay, this is our situation when we're lying down. Our blood is getting to the brain because there's no gravity pulling the blood down to our feet. However, for us to stand up, or for us to assume an upright posture, something has to happen in our bodies to stop the blood from going down to our feet. Something has to keep the blood up into our brain, because the minute the blood comes out of the brain, if the brain is not supplied by the blood, you will fall, because the brain is without blood. So it's the equivalent of taking this hose pipe, which you're using to water your plants, and instead you're moving it up like this, right? So now you've got the effects of gravity pulling the blood down, pulling the water down, i.e. you're not getting the jet which was going to your plant. Instead, when you've got it like this, all the water is coming out like this and hitting your plant. But if you turn it like this, then what happens is the water is going to come down like this, and therefore miss your plant altogether. And that's what would normally happen. But the body is equipped with a bunch of reflexes, which are designed to try and prevent the water or the blood sinking to our feet. And those are called, and the reflexes that we're equipped with is a tightening of all our blood vessels. So it's essentially the same as someone then, when you do this, putting a thumb at the edge of the hose pipe so that you generate more pressure, which then continues to keep the water going to your plant, all right? So if you're like this, water's coming out easily. If you're like this, the water's going to come out but not hit your plant. So you have to tighten your grip around the hose pipe and put a finger on the edge so that the water comes out with more pressure. That's what we're equipped with. That's what happens when we stand up. Our blood vessels tighten up, and therefore all the blood keeps getting pushed to the brain. However, in some people, particularly young people, what tends to happen is, yes, you get that effect, but then slowly the finger loosens and the grip is released, and the water stops reaching the plant, and the sort of flow doesn't reach there. So essentially you have this finger which is gripping on to the end of the hose pipe, but instead of it staying there, it sort of loosens, and the water which was hitting your plant like this is now starting to come this way. And what therefore happens is that the point which is furthest away from your heart, right at the top, is the back of the brain. The back of the brain deals with vision, and it deals with hearing. And so as the blood starts draining out, the first thing often people complain of is either visual disturbance or buzzing in the ears. Then as the blood continues to drain out, you start feeling dizzy. The heart will then try and speed up to try and keep the blood going to the brain, because there's less blood in the brain, so the heart speeds up, so people often get palpitations. And if they don't do anything about it, eventually they slump to the floor. And then as soon as they slump to the floor, there's no effect of gravity anymore, and therefore the blood starts going back to the brain, and they feel better after a little while. And that is usually the mechanism of faints in young people. So in that, this is also something that tends to be more noticeable, particularly in hot environments, so hot rooms. And the reason for that is that if you are in a hot room, or if you've just had a hot shower or a hot bath, or if you're in a very emotional place where you feel hot and you want, that's where people often say, well, that's where I really feel it coming over me. And the reason it happens that is because when you're in a hot room, for example, the natural response of the body is to try and lose heat. That's why we get red when we're in a hot room. We're trying to lose heat. So all our blood vessels are actually opening up to try and get rid of the heat. But of course, if you need your blood vessel to be tight to keep the blood up to the brain, then you're in a situation where that is counterproductive. And instead of tightening up, you're actually in an environment where there's a more chance of the blood vessel loosening or relaxing, and therefore the blood drains out. So what do you do in this setting? Very easy. What you should do is if you can, the first thing you do is try and get the hose pipe pointing downwards again. If you feel the symptoms coming on, the best thing is to either lie down or bend over or get closer so the effects of gravity are minimized. So lying down makes people feel a lot better. So if you can do that, point the hose down again towards the plant. If not, what you can do is turn the tap on so that there's more pressure, and says water comes out with more force out of this hose pipe so that it reaches the plant. Now, how do you increase the tap? Well, you drink more, okay? Now, you drink more water, drink more salt. Of course, it's no good at that time when it's happening, but if you make it a habit to drink more water, a habit to drink more salt, then there's going to be more volume in your body, and therefore you're already, if the water out of the hose is coming out at a greater pressure, then you can even afford to do that, and it'll still probably reach your plant. So that's another tip. The other thing you can do is wear compression stockings. Okay, so compression stockings are really good, and basically what that is it's the same as having a little hand or grip on the pipe to stop it from opening up, and therefore maintaining the pressure. What else is good? Avoiding diuretics, so avoiding tea, avoiding coffee. That's important, because these are diuretics. They dehydrate you, they reduce the amount of water in the pipe, and therefore they're likely to precipitate the problem. One other thing I would like to say, however, is that there is a very good website if you're fainting called www.stars.org.uk, and there you can find out tons about this condition. I think it is also really important to say that if you ever have a blackout, or if you know someone has a blackout, that is serious, and you really should go and see a cardiologist with regards to that. A lot of people go to their GPs and may necessarily not be given an answer. I think it's important to ask to speak to a cardiologist if you know anyone who has blacked out. If you know anyone who has a family history of sudden unexpected cardiac death, then any of these symptoms could be significant, and I would not wait. I would go and seek advice, ideally, again, from a cardiologist. If this happens in children, you should definitely go and seek advice from a pediatrician or a pediatric cardiologist. My advice is very much for the younger population of patients, and those who say to you, well, that's what I've been doing for the last 6 months or something like that. The first one, if you have a first one, I think it's always good to seek medical attention, because you don't know what it is. It is more likely to be the thing that I've described, i.e. reflex vasovagal syncope, but equally well, if it's the first one in someone please, please, please go and seek medical advice specific to you. But I hope this was useful. I'm very grateful for all the great feedback I get, and the encouragement I get to continue to do this. I wonder if you could please, please, please consider sharing this video. Here is my name. Oh no, sorry. Oh, crikey. Here's my name. Sanjay Gupta, consultant cardiologist. This is my website, yourcardiology.co.uk. I have a Facebook page, yourcardiology@gmail.com, and then you can also get in touch with my secretary, Jeanette. But please, if you could consider sharing this, I'd be very grateful. Thank you so much. Have a good day.